So part of the channel is Australia asking questions of the interviewee.
Yep.
So they hop on our socials and put the questions they actually want to ask. And we've got a question from Seal in Narara. Why are nurses so stretched today compared to 15 years ago? They seem to be just running everywhere and doing everything and just so many patients in their wards.
Yep.
What's changed?
I think that's a huge question, and thank you for the question as well. I think one of the main reasons is multifactorial. So you've got, from a workforce side, you've got people leaving the profession in higher numbers than they ever have, for multiple different reasons, including burnout. So there's that issue that there's now less nurses, less health professionals on the floor. And this is, I'm just going to speak for New South Wales just for a moment, less nurses on the floor. So that immediately presents a problem because you've got less workforce and the same, if not more, patients coming through the doors. You've then got a population where they're a lot more medically complex. They're on more medications. They've got more medical comorbidities. It's not just someone with high blood pressure or high cholesterol anymore. It's someone that's had 3 heart attacks. They've got multiple stents. They've had a stroke. They've got diabetes. They've got kidney failure. They're very, very medically complex. And medically complex patients do require more care, they require more time, and they require more input just by the nature of the diseases that they're presenting with and the medical issues that they present with as well.
Is that why the nurses are pushing for ratios? They believe that if they have fixed ratios that could be fixed?
Yeah, so I suppose and this was one of the great things that the now Minns Labor government took to the very recent state election was moving to safe staffing levels. So in particular, 1 to 3 in ED. So that means 1 nurse to 3 patients. That hasn't been the case in the past. And if we move towards that, you're going to see patients who are monitored more frequently. We're going to be able to recognise the deteriorating patient faster and also provide optimum levels of care. And that's been shown in other states. That's why the Nursing and Midwifery Association were pushing for that. That's why the Minns Labor government have moved towards the safe staffing levels, and they took that to the election. And it's a big issue here on the coast. So I think it's very multifactorial. We've got that from the state government. We're doing our Tafe and university policies for areas of need and national priority, including healthcare. So that's 500,000 fee-free Tafe positions, 22,000 additional Commonwealth-supported university positions for areas of need and national priority. It's looking at ways that we can reduce student debt for healthcare professionals in rural and remote settings. There's trials down in Tasmania about general practice. There's the urgent care centres I was talking about. It's part of the whole suite of policies that now the federal government and the state government will work together to make sure we're taking pressure off our hospitals, including our nurses.
Peter from Flynn asks, is the COVID epidemic over? Or why did we stop wearing masks? Is it done with or not?
No, thank you, Peter, for your question. No, it's not. COVID is not finished and it is not over. And I'll take a moment to say that if you are unable to safely socially distance and if you're unwell, 1, stay home, get tested, and 2, wear a mask, ensure you wash your hands and keep up to date with your vaccinations. It's not over. We still see patients presenting with COVID-19. We do see there has been a reduction in the amount of patients presenting with severe disease and who are dying from COVID because of our high levels of vaccination. But I would highly recommend that that the wider community do keep up with their COVID-19 vaccines in consultation with their general practitioner who know their medical history better than anyone. Because it does save lives. It saves lives every day, and not just COVID. I look at the influenza vaccine as well. Also important to make sure that you're keeping up to date with that, again, on advice from your general practitioner and your healthcare professional, because we know that it's not just COVID, there's also influenza and the like that are also quite dangerous. Those respiratory pathogens can be quite dangerous, particularly too if you're immunocompromised. So if your immune system isn't quite as strong as it should be, or if you're in the elderly population. So it's important that you take that advice from your doctor, but keep up to date with your vaccines, wash your hands and wear a mask.
Okay. Carol from Kipper, his question was, Bob Hawke said that no child should live in poverty, yet still 1 in 6 are. What's Labor trying to do to fix that problem?
So I think it's about access. One of the big ways that we can lift people out of poverty is access to healthcare, access to education, access to food and essential services, and access to clean water. We've known how to lift people out of poverty for quite some time. We just need to put the time and the effort and the funds into it. That's the importance of the Housing Australia Future Fund and investing in social and affordable housing. That's the investment in the cheaper medicines. That's the investment in the urgent care centres and the Medicare Strengthening Fund to strengthen primary care. That's the investment into TAFE. That's the investment into university. It's again not an issue that you can silo into one thing. It's something that you need to look at more broadly across the economy, across the sector, across the community. It's coming together as one and making sure that we're taking the issues of the Central Coast, which this is one of, to Canberra and to Macquarie Street and to the administration, and making sure that our voices are heard in that regard. And this will be an important factor with the voice as well, because there are many policies and there are many issues within the Aboriginal and Torres Strait Islander community that currently don't have a voice and don't have a seat at the table at the moment, and this is what the voice will provide.
Thank you. So Shane from the Gossman Anglican Justice Ministry has asked a question. The Greens just put forward a bill to evacuate the people on Nauru and the Pacific Islands which needed medical help and whatnot, but it didn't make its way through. That they believe that it was well worded for Labor, but it just didn't make it through. What do we think we can do to try and finalise that issue?
Yeah. Was that from Shane? No, thank you for the question, Shane. Look, I think one of the biggest roles that I see myself having is getting your issues in front of the minister. I see myself as almost a bit of a liaison service. It's my job to annoy people on your behalf. Again, local, state or federal issues. This obviously being a federal issue about offshore detention and issues surrounding offshore detention. And what I would do, I would encourage Shane, and I'm sure you can pass on my details to Shane, to write to me, and I will then make sure that his question and his concerns are put before the minister. That's definitely my job. But the health and well-being of Australians is something that I take very seriously. I always have taken it seriously. I still take it seriously, and I think that's really important. So I'd ask Shane to please write to me. I'll pick up the phone, I'll have a chat with you, and we can go from there.
Excellent. So Alex from Narara, she's asked, there's rumours that they're going to shut down Gossman Tafe. We were talking about how beneficial it is now having Arimba University and the doctors and nurses buildings in Gossman Hospital. Losing a TAFE on the coast would be devastating for our education.
Yep.
What can we do to try and continue to build education on the coast? Because that is one of the things which really lifts a populace, is education. So what can we keep doing to try
and was Alex, was it?
Alex.
Yeah, no, and thank you for the question, Alex. TAFE is one of our most important educational institutions, and it has been. And it's not just a stepping stone to university, or it's not just a stepping stone to something else. It's an educational institution that has led to the prosperity of millions of Australians for a long period of time. And not just in the trades, in IT, graphic design, you name it. It's been a central part of our community here on the coast in particular. That's why, I'll go from a federal perspective for just a moment, we committed to 500,000 fee-free TAFE positions, including our new energy apprenticeships, some of which are the usual apprenticeships, but they're going to be highly needed and highly sought after when we move through our energy transition to include renewable energies into that energy mix. So TAFE's always been a vital and important part of that. TAFE had the belly ripped out of it by the former Liberal National Government in New South Wales. It really did. There's no two ways of putting that. And it's been sad to see. It's definitely been sad to see, and I'm glad now that the Minns Labor government, together with our Labor team here on the Central Coast, have really put TAFE and tertiary education as a priority, as a priority for our region forward to those more executive levels of government. And this is something that I definitely will be having discussions with the new Minister for the Central Coast, David Harris, about, and also the new Minister for TAFE, as well. I think it's important that we make sure that our voice is heard with regards to TAFE and tertiary education here on the Central Coast at those highest levels.
For me personally, it was a game changer for me. Learning through TAFE was the way I learned to learn.
Exactly.
My schooling was, me and school didn't really go together very well, but TAFE was where I learned to learn and gave me everything. So
learn to learn, and also too, from what other people say, it's very practical, it's very hands-on, and you learn how to do the skill, you learn how to do the trade, you learn how to do the profession better than anywhere else in the world.
Yeah, absolutely. So that's the end of part 4 of our discussion with Gordon Reid and your questions. Hopefully we covered them all for you. The next part will be big future. Where does he see Australia and the Central Coast going?